Hi everyone, my name is City Birth and I am currently a cardiovascular physician assistant that was working for the Cardiovascular Clinic of North Georgia in the north part of Georgia, of course, but now I'm transitioning to work in cardiology in Florida and looking forward to doing that. I know most, when they hear me say physician assistant or they hear me say I'm a PA, they're like, I have no clue what that is. So just in case you're not familiar, I'm going to explain what being a PA entails and what all of that means. So basically, a physician assistant is a healthcare provider licensed to practice medicine in whatever state they choose to practice in. A physician assistant is just like a medical doctor, except our schooling is fast track. So medical doctors go to medical school for 4 years, and then they go to residency where they're trained in the specialty that they were chosen to work in. And then they can choose to go to a fellowship where they would do 1 or more years getting even more training in that specialty that they graduated from. With physician assistants, depending on the school that you get accepted into, it's at least 2 years. My program was 29 months. And then once you graduate your school, you get hired for the specialty that you want to work in, and you are trained even further on the job, but you don't have to go back to school for that. And you just get trained on the job and use your medical knowledge that you had just from your physician assistant training those 2 years or 29 months, however long your program is. The good thing about being a physician assistant, comparing it to being a doctor, is you can choose any specialty you want to work in without having to go back to school. So doctors, once they graduate their medical school residency and possible fellowship, they have to work within that specialty unless they go back to school for at least 3.5 years to be retrained into something else. Physician assistants, you can choose one specialty, and if you decide, I'm very bored of this specialty, or I just want to learn something else, you can apply for a job somewhere else and work within that job without having to go back to school because you get trained on the job. So if you wanted to do surgery, physician assistants can do surgery, and you are thoroughly trained in surgery in school, and then once you get into your job, they train you even further to make sure that you're comfortable and that you can do things on your own. One difference, though, is you would always be known as a first assist, so that means that the doctor would be the lead surgeon, and you would be the one right under him or her to do surgery on your patients. But you could do surgeries, you could practice like I do in cardiology, which is the heart. You can do pulmonology, which is the lungs. You could do specialties in the stomach, which is called gastroenterology, which entails the intestines and your spleen, your gallbladder, things like that. You could do bones, which is orthopedic medicine. But basically, my point is, as a physician assistant, you can work in any specialty. You're not limited to one particular specialty just because you don't have as much schooling as a doctor would once he or she graduates. So what led me to my current job? When I was trying to decide what I wanted to be when I grow up, I actually had no clue. In high school, I thought that I was going to be a broadcast journalist because I like to talk, I like to be in the camera. So I started writing for the newspaper. I did a lot of sports editing for the newspapers in the high schools. I also wrote for some newspapers in South Carolina. And then when I was in my senior year in high school, my guidance counselor told me that I had to choose one of 2 classes in order to graduate. One was going to be anatomy and physiology, the other was going to be environmental science. I didn't really like environmental science, so I chose to do anatomy and physiology. And once I had done that class, I had fallen in love with just being able to dissect different things and learn about different parts of the body and how it works and how disease affects them. And so that's when I fell in love with medicine and decided that's what I wanted to pursue. But I still didn't know what a PA was until I got into college. So at first, when I got into college, I majored in biology. I thought that I was going to want to be a doctor, and then I ended up meeting a PA, or physician assistant, and that's when I decided PA was the thing for me because the schooling wasn't as long. You could still have a life, have a family. I could choose whatever specialty I want, but still be treating patients just as much as a doctor can. One difference, when you choose to become a PA, you have to know that you always have to have a supervisor be a doctor. So that doesn't mean that he or she has to be there watching over you, but he or she has to be your boss. You can still open up your own practice, but he or she has to be a part of that to supervise, to be known as your supervisor when you practice medicine. Doctors don't have to have that. So that is one difference, but you're still not limited to things that you can do. There's just certain scopes of practice that you're able to do as a physician assistant, depending on what you and your supervisor discuss under your contract once you become licensed as a PA. So as far as what school and experience you have to be able to be a PA, well, of course, with schooling, you need to have a bachelor degree. So that's a 4-year degree in college. You can choose any major you want to, but you have to have certain prerequisite classes like chemistry and biology. And some schools actually require genetics now. And then you go to PA school of your choice once you're kind of accepted into it, because you have to go through a test called the GRE. Once you pass the GRE, you then get interviewed by the schools that you apply to, and then whoever accepts you, that's where you would go. And usually, like I said, those schools are at least 2 years long before you can practice medicine. And then once you graduate PA school, you have to take another test called the PANCE, PANCE, and that is your licensing test. So once you pass that, you're licensed to practice medicine, and then you choose the state that you want to practice in. So it seems like a lot, but when you are in charge of people's lives, you want to go through that much training and have that many tests so that you won't be killing people. So an average day for me at work, I guess it depends on the week. I practice both outpatient and inpatient medicine. So that means that when I'm working in an outpatient setting, people come in to see me and then they go home. So usually when I'm doing outpatient settings, my hours are about 8:30 to 5 or 5:30. I see on average about 20 to 24 patients a day. And I could do anything from just follow-ups or making sure that they're tolerating a particular medication, or they're feeling well, or I can see new patients where they feel something's not right with their heart and they want help figuring out and feeling better. And then if I were to work in the inpatient setting, that is just basically the hospital. So all the patients usually come in from the emergency department. They're very sick patients, and these patients, we keep them in the hospital beds until we can figure out what's going on with them and hopefully make them better. I also take calls, so that means that I could be at home, but if someone is very sick in the hospital, I get a call from the hospital saying there's a patient here and this is what's going on, and then we have to figure out what to do and if we need to come in to make them better at that time. Best part of my job is, of course, I get to meet new people, I get to learn every day, and I'm making people better. Hardest part of my job is when you can't make someone better, or I'd say the hardest and also the most stressful part of being a PA is every day you don't know what you're going to see, you don't know how sick a patient is going to be, and it is your job, you're the person that has to make them better. So that can be very stressful sometimes when people come in with things that are not straight from the book. For example, someone may need a particular medication, but they're allergic to that medication. So you have to figure out what can I give them to make them better, since they can't have the medication that usually fixes things. So that can be very stressful. As far as long-term goals, I know that medicine is my love. So I think long-term I will always be doing something with medicine. Right now, I just like to be a clinician. So clinician meaning I like to treat patients and diagnose them with whatever is going on with them. But maybe down the road, I will decide to do more teaching. I do mentor a lot of students, especially students who are wanting to become a PA and just needing some guidance on how to get down that track. I also mentor people that have graduated PA school and are still new and just learning the PA world, so I enjoy doing that. So long term, I'll probably continue to do that as well. Advice for you when it comes to finding the career you love. Don't let someone tell you what you should do or who you should be. You make that decision for yourself. It doesn't matter if a particular job pays a lot of money. You can make a lot of money and be miserable. And I always believe that it is best to work in a job that makes you very happy, so then you can stay in that for long term. Then you can be fulfilled with whatever you do in your career. Thank you for listening to me. If you have any other questions, please don't hesitate to reach out. I enjoyed teaching you about being a PA. Bye.